Hey, I'm going to talk about Belatacept and long-term outcomes in kidney transplantation. The definition. Well, Belatacept is a selective co-stimulation blocker that has been developed to improve long-term outcomes in kidney transplant recipients by providing effective immunosuppression without the toxic effects of calcineurin inhibitors.
The use of immunosuppressive therapies in patients with kidney transplants has reduced the incidence of allograft rejection. The current standard of care immunosuppressive therapy includes calcineurin inhibitors, such as cyclosporin, plus anti-proliferative drugs with or without maintenance glucocorticoids. However, calcineurin inhibitor-based regimens may not adequately preserve allograft function. In this 7-year extension of a previously published 3-year randomized trial, investigators compared the ability of Belatacept and cyclosporin to preserve allograft survival and function. Belatacept is a fusion protein composed of the Fc fragment of human IgG1, linked to the extracellular domain of CTLA4. It blocks T-cell co-stimulation, thereby selectively inhibiting T-cell activation. 666 patients who had received a kidney transplant from a living or deceased donor were randomized to maintenance treatment including a cyclosporin-based regimen, a less intense Belatacept-based regimen, or a more intense Belatacept-based regimen as primary immunosuppression. All patients received basiliximab induction and mycophenolate mofetil and glucocorticoid adjunctive maintenance therapy. At the end of 7 years of follow-up, the Belatacept regimens were more effective than the cyclosporin regimen. The estimated rates of death or allograft loss were about 22% in the cyclosporin group and about 13% in each of the Belatacept groups. The estimated glomerular filtration rate was also higher with Belatacept than with cyclosporin, suggesting that Belatacept may be less nephrotoxic. The cumulative frequency of serious adverse events was similar across all 3 groups. Thus, treatment with Belatacept as compared with cyclosporin reduced the risk of graft loss or death after kidney transplantation. Full study results are available at nejm.org.
Applications in medicine. In previous analysis of benefit of phase 3 study, Belatacept-based immunosuppression as compared with cyclosporin-based immunosuppression was associated with similar patient in graft survival and significantly improved renal function in kidney transplant recipients. Here we present the final results from this study. Belatacept was approved by the U.S. Food and Drug Administration, the FDA, and the European Medicines Agency in 2011 on the basis, in part of 3-year data from 2 phase 3 studies. The Belatacept evaluation of nephroprotection and efficacy as first-line immunosuppression trial benefit, and benefit extended criteria donors benefit EXT.
For me, it was a shock because I was perfectly healthy on Tuesday. On Wednesday, I was short of breath. Went to the doctor thinking I had bronchitis, pneumonia, something. And it turned out to be I wasn't. My lungs were shutting down. They could get my lungs back, thank goodness, but they could never get my kidneys to come back. Going through dialysis keeps you alive, and I'll always say that. But it is not a comfortable way to live. You're very, very restricted on what you can drink, eat. And my doctor was really, really supportive of knowing my personality that I would do much better if I could get the transplant. All of a sudden, your life is back. Maybe not quite as normal as it was before, but it's just like a miracle that can't describe it, how the feeling is. They approached me with it and explained what the study was and why they were trying to have people enter into the study. And at that point I thought, well, if it'll help somebody else down the road, I'll be my, hero self and I'll do it.
The Emory Transplant Center was very involved in the development of the whole class of drugs that Belatacept fits into.
The average lifespan of a deceased donor transplant, the most common type, would only be 8 to 12 years. But if you're a young person coming to transplant, that means you're looking at potentially needing 2 or 3 transplants for a normal lifespan. So Belatacept offers the first alternative to the cyclosporin type drugs that have been the mainstay actually for nearly 20 years. They offer an alternative that looks like it achieves the good short-term outcomes that we wanted to maintain, but it preserves kidney function and reduces cardiovascular side effects as well.
Methods. The trial design has been published previously. The original study was a 3-year international randomized single-blind parallel group study with an active control. The participants were adults who received a kidney transplant from a living or deceased donor, with deceased donors meeting standard criteria donor status on the basis of age and other benchmarks. The primary objective at month 12 was an assessment of the composite endpoint of patient and graft survival renal function, and the incidence of acute reaction in each Belatacept group as compared with the cyclosporin group.
The problem is that transplants just don't last as long as we like them to. The way your body rejects an organ, a transplant, is it recognizes it as foreign. Now that's a good thing in the case of a virus. We want your body to respond to a virus. In the case of a transplant, that's not what we want. We want to control the immune system. The way the immune system gets activated is first it gets a recognition signal. It says, oh, this is foreign, and it starts a response. But it also needs a second signal, a second set of interactions to occur, and that's called co-stimulation. And Belatacept blocks that second signal, that co-stimulation signal. So the transplant is recognized as foreign, but that go signal, the co-stimulation signal, is blocked.
The results. Of the 666 patients who underwent randomization and transplantation, 660 patients were treated. 153 of the 219 patients treated with the more intensive Belatacept regimen, 163 of the 226 treated with the less intensive Belatacept regimen, and 131 of the 215 treated with cyclosporin were followed for the full 84-month period. On the basis of Kaplan-Meier estimates rates of death or graft loss with more intensive Belatacept, less intensive Belatacept, and cyclosporin were 7.8% and 8% and 11.4% respectively at month 36, 10.2%, 9.2%, and 20.2% respectively at month 60, and 12.7%, 12.8%, and 21.7% respectively at month 84. Well, at month 84, the cumulative frequency of serious adverse events for more intensive and less intensive Belatacept regimens and for cyclosporin were 70.8, 68.6, and 76% respectively.
The Bella infusions are great. You get an IV. Once that's done, you just sit. So it's really a easy process. There's really nothing to it.
I think for many patients, Belatacept may be an improved quality of life in addition to hopefully an improved survival of their transplanted organ.
My customers always ask me where I had my transplant, and I always tell them Emory. And I always tell them I had such a good experience that I think their staff here, and with all the innovations that have come to Emory, to be able to do some of the things that they've been able to do, I think it's just an exciting time. And then after the transplant, it just gives you your life back. It's just like a miracle that you can't can't describe it, how the feeling is. It's just a wonderful experience.
Pros. In our studies, the risk of death or graft loss at year 7 was significantly lower for Belatacept-treated patients than for cyclosporin-treated patients. The cons. One limitation of our trial was that we did not compare Belatacept with tacrolimus, the current standard of care calcineurin inhibitor. Issue plan in Ecuador. We assessed efficacy and safety outcomes in kidney transplant recipients who were treated with maintenance immunosuppression beyond 5 years. Other studies of immunosuppressive regimens have reported outcomes up to 5 years after kidney transplantation. Thank you very much.